In today's episode, we're counting down the top 5 mistakes telepsychiatrists make and how you can fix them. So, I've done a lot of telepsychiatry in my life, and I've worked with county behavioral health systems, community mental health systems, psychiatrists, psychiatric nurse practitioners, and over that time, I've seen a wide variety of how telepsychiatry is done. And it's been done brilliantly when certain rules are followed, and it's done poorly when those rules have not been followed. And let's get better at this. Let's do better with telepsychiatry. Let's evolve. And the beginning of that process involves looking at the things that we're not doing well and addressing them. So, we're going to level up today. We're going to talk about the top 5 things that telepsychiatrists do that are not so great. And we're going to talk about what you can do instead. So let's start with mistake number 5, poor eye contact. What would you do if I spoke with you, but I wasn't looking at you at all? Well, we've been taught early in our lives that eye contact is really important. So it's no different with telepsychiatry. Even though it's through a camera, you want to establish virtual eye contact. You want to look at the camera like I'm doing right now. You don't want to necessarily always have to look directly at the camera, but most of the time you should have an eye at your camera. And if you have to look down occasionally to write some notes or do some other things, do it quickly and seamlessly, because if you turn your attention away from the camera for too long, the patient's going to think that you're not listening to them, especially when they're talking. So my recommendation, and I want to say that again, especially when they're talking. So when they're talking, you want to look at the camera like I'm doing right now. Because if you're not looking at the camera and you're looking down, the patient thinks that you could be doing anything other than listening to them. And there's been some research that's been published that shows that simulated eye contact or virtual eye contact, which is achieved by looking at the camera, is one of the best predictors of patient satisfaction and perceived empathy. So you could be the best clinician in the world, the best psychiatrist in the world, the best psychiatric nurse practitioner or PA in the world, but it won't matter if the patient thinks that you have no empathy and that they're not being heard. So again, this goes back to, we want to be heard as human beings. And part of the feeling of being heard is somebody looking at you and not looking down or all around. So you ask me, Dr. Kaftarian, well, how can I do that? Because I still need to keep an eye on my notes and the medical record and whatnot. Well, if you must do that, then pull your window that shows your medical record or whatever you're working on up close to the camera, so that if you do have to look down at the note, it's done in a way where you can still kind of feel like the patient can still feel like you're listening to them and you're looking at the camera. So that's a good way to make it look like you're looking at the camera, even if you have to look down for a moment. Mistake number 4, conducting appointments in unprofessional locations. Because telepsychiatry gives us geographic freedom, some providers push the boundaries from flexible right into absurd. And I've seen this myself. Not too happy about this, but I heard that one of our psychiatrists had been seeing a patient while they were in the back of an Uber on their way to the airport. And that was not professional. The clinic that received that care complained, and the patient complained, and it was just a very unprofessional situation. Now, fortunately, it does not appear that there were any HIPAA laws broken, because the provider did not reveal the patient's name, and there were identifying information, and also they were wearing headphones. So the person on the other end, the patient, was not heard by the Uber driver. But nonetheless, it gives the patient a very bad impression. and frankly, almost gave me a heart attack listening to it. So listening to the fact that it happened. So whether you're in the back of an Uber or waiting at an airport gate or in a coffee shop with a barista shouting out venti or whatever they're gonna, I don't know. I'm not a coffee drinker, but you don't want to have that situation where you are in an unprofessional background, unprofessional situation. And that can be both visually and also audio. So if the patient is seeing your background and they see a coffee shop, visually, it's not going to look professional. And they're going to think that maybe their privacy is being violated. And maybe HIPAA and privacy laws may be violated in certain situations. And that's obviously a problem. But it can also be an audio problem. So if you're in an unprofessional setting, like a coffee shop, sorry, I'm picking on Starbucks here, but if you are doing your appointment from the coffee shop and you hear a lot of noises, then that's going to be very distracting um, for the patient. I mean, I can't believe that you would want to do that because that would be distracting for you too. So don't do that. Okay. So let me be very clear. You're a medical professional. You're not a travel vlogger. And doing an appointment from an unprofessional location is not good. And you should not be doing that. So please don't do that. Okay. It needs to be a secure environment that looks professional. Like I've said in a past episode, you can have fun things in the background. Like I have my jiu-jitsu man in the background. But generally it's professional. I have my diplomas and books, and it makes it look like a real doctor's office. So you do not see Starbucks mocha cup and in the back with people walking around. You don't see that, and therefore this is a more professional setting. And now a quick word from Orbit Health. Orbit Health is a telepsychiatry company that provides services to California County Behavioral Health. If you're a psychiatrist interested in working with a company that will support you and put you in the best position to succeed, there's no better choice than Orbit Health. If you want to learn more, go to orbithealth.com. Thanks. Mistake number 3, not having an emergency protocol. I've talked a lot on this podcast about what it takes to manage high acuity patients remotely and the importance of having an emergency protocol. Yet a lot of you don't have emergency protocols in place, and that is a no-no. You need to know what happens, what you need to do if things go wrong. So what if the patient expresses suicidal ideation and a plan to kill themselves, and you're concerned that they are in an imminent risk of killing themselves? What if they show you a weapon and then they hang up the phone? What if they say that they're going to harm somebody else? So these are all things that the stuff of nightmares for me and other psychiatrists if things happen like that. But with telepsychiatry, you can still have a plan, and that plan needs to be: who are you going to call? How are you going to dispatch a local crisis team? How to reach the patient's emergency contacts. So you don't want to be flying blind. Risk management means that you need to think about this in advance and have all of these tools available to you so that when things go wrong, you're not just stuck not knowing what to do. And that can be a very scary experience. Now, the risk of this is a little bit less when you're in a clinic with other professionals that can assist you, like the telepresenter and RN, other people that are on the patient side. But if the patient is alone and they're in their home with nobody else there, then you absolutely ought to think through what's going to happen when the patient has some sort of crisis. And this is something that you can either put into policy, or you can have like notes on your bulletin board of what you're going to do. Or maybe you can be in your head, but definitely get it clear as to what you're going to do and prepare in advance. At minimum, have somebody that you can call. And when you're calling, let's say 911, just again, I've said this in past episodes, your 911 is not their 911. Okay. So if I'm in Los Angeles and I'm talking to somebody in Texas and I pick up 911 and say my patient is suicidal and there needs to be some sort of police response, they're going to probably look at you like, how are we going to do that in Austin, Texas or Tulsa, Oklahoma? We are here in Los Angeles. So keep that in mind. And you can fairly easily find the emergency number for their location, but you have to know their location, which brings us to the next mistake. Mistake number 2, failing to verify the patient location at every visit. If you're serving a clinic or a hospital, this is less of an issue because you will typically know where your patient is located. If you are doing telepsychiatry to a hospital clinic, you will typically know the location, but maybe not. And if you don't know that, you need to learn that. Okay, so where is the patient? Now, if the patient is not in the clinic and they're at home, you ought to verify where they are, okay? And my recommendation is to do that at every visit. And, I would recommend to document that you verified. It depends on the state laws whether you need to document verification of their location, but I think it's just a good idea to do that, just so everyone knows that you verified it and you know that the patient is in that location. So I was seeing a patient a few years ago, and I noticed that their background was different. It didn't look right. And so I asked, "Where are you? Are you in a car or something?" And they said that they were in the back of their truck. And I thought, "Oh my gosh, okay, where are you physically located?" And the patient told me, "Well, I'm in the state of Washington." And so I did not have a Washington license. And so I said, "Okay, listen, I'll say John Doe, okay? Mr. Doe, I don't have a license to practice medicine in the state of Washington, so this is not really a valid visit, and we need to reschedule when you're back in California." So this gentleman was a truck driver and was finding himself in a different state during the appointment. And on the patient side, they don't think about it. They don't think, well, I'm in a different state, so this doctor doesn't have a license to practice medicine in that state, and they're not going to think about it. So you need to think about it. So I am hoping that you do think about the fact that the patient might be in a different location, and you verify that. And this ties into your emergency protocols. Like I said, if you need to send 911 after your patient, but you don't know where your patient is, that's a problem. Imagine calling 911 saying, "My patient is going to kill himself and we need police to respond." Okay, can you tell us where the patient is? "Oh, well, I think they're in San Francisco." Well, okay, well, what can we do for that? I mean, we don't know where the patient is, so we can't help you. So definitely verify the location of the patient. Another note on that is that you might have their home address on file, but maybe they're not at home. So just realize that that can also be a problem. Another thing is you do want to verify their home address that's on file as well, because you don't want the wrong home address. You don't want to think that your patient is at home. They say that they're at home, but they actually moved 2 months ago to a different home address. So now you're sending the poor police over to a location that is not their home and bothering somebody who is not them, and maybe getting somebody in trouble. You do not want somebody other than your patient to be subject to a 5150. That could be liability for you. So I would say for sure avoid that situation. Mistake number 1, not completing the note prior to the end of the day. And I put that mistake at the top of the list because it happens so frequently. And I want to ask you, please don't do this. When you have seen your patient, don't tell yourself, "Oh, I'm kind of tired. I'm going to document tomorrow. I'm going to save one of my notes for tomorrow, or all of my notes for tomorrow, the next day." Don't do that. And I can tell you from personal experience that this leads to problems. So when I was the senior psychiatrist at a prison, one of the people that reported to me, one of the psychiatrists, um, she did not complete her note before going home for the day. And then when she came back to the prison, unfortunately, her patient had killed themselves overnight. And it's a very tragic situation, of course, anytime somebody kills themselves. But this situation was made even worse because she had not completed her note. And so when she got to the office, she heard that her patient died, and then she started documenting as if it was the note from the previous day. And she got into some trouble over that because it looked like she was trying to cover it up. And even if she wasn't trying to cover it up, even if she was just recounting what she did the day before, she had no credibility because you can say you did everything in the world the day after something bad happens, but nobody's going to believe you. So this is the number one problem, not only for telepsychiatry, but I think in psychiatry in general. The number one thing that is my pet peeve and that causes problems is failure to document as soon as well, you can wait until the end of the day if you want to, but do not go home, do not turn everything off and go to bed without finishing your notes. Not only are we talking about a liability problem here, but also, you might not remember what happened the day before. Our memories can be faulty and nuances can matter. And so, even though you think you remembered what happened, it's possible that you don't remember every detail that might be important. For example, did the patient have a blunted affect? Did they have pressured speech? I mean, exactly how was they expressed their passive suicidal ideation? How was that expressed? So it's not just a matter of liability, it's also a matter of quality. You want to provide a high quality note. And why give yourself a handicap by doing the note much later than when the session happened? It doesn't make sense. It's not the best standard. And here at the Telepsychiatry Advantage, our goal is simple: raise the standard for clinicians, for systems, and ultimately for patients. And if you're a psychiatrist who wants to do psychiatry, telepsychiatry the right way, and you want to work with the company that handles the operational side and gives you support and works with you to make sure that things are great with telepsychiatry, Orbit Health is always looking for top tier psychiatrists. But we don't want psychiatrists that do those mistakes, those top 5 mistakes. So if you're one of them, then change how you practice. And one more thing, you may have been thinking, oh, I did one of those, or I did 2 of those, or I do 3 of those. Well, the more you do, the worse it is. So if you have done 2 or more of those things, you are not ready for prime time. You need to level up your care and your practice. So, and I know you can do it. I know you can because you're smart. I'm assuming that you are. And so, thank you so much for tuning in. Really appreciate how this podcast has grown in the audience. We're getting some positive feedback, and we are going to continue to be there by your side to help level up telepsychiatry for you. I'll see you on the next episode of the Telepsychiatry Advantage.